12 weeks to turn the tide was Boris Johnson's message at today's Downing Street press conference. But he said that the virus would only be sent packing, in his words, if the public followed medical advice on social distancing. Despite images showing that was not happening on some busy tube trains and streets in London, there were no extra restrictions on travel or gatherings for the capital. He promised businesses desperate for help in paying their workers that they would have more information tomorrow, and appealed to them to stand by their employees. The Bank of England took its own action, cutting interest rates to a record low of 0.1%. Our political editor, Gary Gibbon, is in Westminster. Gary.
As you say, we got some pretty big moments today. The Bank of England decision, extraordinary stuff. We got 350 pages worth of emergency legislation, which gives extraordinary powers to the government to detain people with symptoms of COVID-19 for up to 6 weeks, to ban events, to compel different organisations within the food chain to behave in certain ways. We got all of that, but in some ways what people were focusing on was what we didn't get. There was an expectation that maybe we'd find out what you might call the sort of reserve occupations were, the people who'd been entitled to a place in specially kept open schools for their children. We didn't get what was much hoped for, not least by quite a lot of Tory MPs, but also people in business and employees, which was what's going to happen to try and keep people in their jobs when employers feel they have no option but to shed them right now. That news is promised tomorrow, and we didn't get what was also expected, maybe some sort of ratcheting up of how life is lived in London, which, as you see from those images and images in this report, it doesn't look as though it has actually dramatically changed. And then we had a press conference with Boris Johnson, the regular daily one now, in which this man who in some ways has a duty now to create a bit of anxiety in the population, because that's the way to get people to change their behaviour, slightly reverted to the Mr. Feel-Good politician. He described himself as someone who believes in boosterism, who likes to put out an optimistic message. And there will be a question in some people's minds as to whether that was quite the right message for this moment. It might change tomorrow, but this is how this extraordinary day in the all-engulfing crisis went.
South London, lunchtime today. Business pretty much as usual. Exactly what the government didn't want. But the Prime Minister today emphasised how the country might get through this if people obey the instructions to keep their distance from each other and change their habits. He said he would use tougher powers if necessary, but the time was not yet.
It's vital that people follow that advice, and you know, there's huge evidence that they are in the takings in the retail sector, the hospitality sector. TfL in inner London down about 80%, in outer London down about 60%. But some evidence that in some parts of the capital, it's very patchy, and some areas where people aren't perhaps following it in quite the way that we need them to do.
Although some at the top of the NHS despair of scenes like these on the London Tube network this morning, a ripe environment for transmission of the disease, the Prime Minister, after 2 days of extraordinary announcements on economic policy and closing schools, seemed to feel this was the moment for a more upbeat message.
I believe that a combination of the measures that we're asking the public to take and better testing, scientific progress will enable us to get on top of it within the next 12 weeks and turn the tide. I don't want to sound, you know, I'm often accused of being unnecessarily boosterish about things, and I certainly don't want to strike that note today, but I genuinely think that by the combination of these two things, we will turn the tide and we will get through it.
The government did unveil a bill giving it extraordinary emergency powers, including the power to detain those with symptoms of the virus for up to 6 weeks, and other powers to ban events, compel food distribution, and much more. The Bank of England hit the emergency button for the second time in 8 days, another interest rate cut to 0.1%, a wafer above zero, the lowest rate since the bank was founded in 1694. It also announced it would buy £200 billion of government debt. The Prime Minister urged businesses not to lay off their workforces, knowing many are on the brink of doing just that.
My message to companies is really think very carefully before you start laying off your staff. We do want to stand behind good companies. We do want to make sure that people recognise that if they stand behind their staff, they should stand behind their staff, because we in the government are going to stand behind British firms.
In the Commons, Tory MPs lined up to demand the government go much further immediately. Some calling on the government to pay troubled employers a big chunk of their workers' salaries to keep them on the books.
On Tuesday, the Chancellor promised that there would be employment support. But as each day goes by, businesses are making decisions that will be irreversible. If the government does not act immediately, large numbers of people will be unemployed.
Following yesterday's announcement of school closures, there's no official word yet about what will happen about exams due to be sat in England and Wales in May and June, but they will probably follow Scotland's announcement. Their exams will be cancelled and pupils assessed on past performance.
I anticipate that this model will use coursework, teacher assessments of estimated grades and prior attainment as the basis of certification. In order for such an approach to be effective, the Scottish Qualifications Authority will require relevant units to be completed and coursework and teacher estimates of grades to be submitted by the agreed deadlines, or indeed sooner where that is possible.
The Queen, following government advice to the over 70s to avoid non-essential contact, left Buckingham Palace for Windsor, where staffing numbers have been reduced. In a statement, she said, "Many of us will need to find new ways of staying in touch with each other and making sure that loved ones are safe. I'm certain we are up to that challenge. You can be assured that my family and I stand ready to play our part."
J'ai été testé hier positif au Covid-19.
Michel Barnier, the EU Brexit negotiator, announced he had COVID-19. The virus has infected or distracted some Brexit officials on both sides of the Channel. It's not known when they'll be able to meet again like this, or if the end-of-year talks deadline will have to be extended. Those working in the NHS will be hoping that the Prime Minister's optimistic turning the tide message reinforces rather than weakens the stay-home and social distancing messages vital to limiting the COVID-19 death toll.
Gary Gibbon. Now, the Bank of England has cut interest rates to their lowest ever and is pumping more money into the economy to try to stop the panic on the financial markets. But will that be enough to save businesses? Our chief correspondent, Alex Thompson, has been speaking to retailers about how they are handling the impact of the virus on their businesses.
This morning, just as business leaders were calling for an immediate emergency postponement of tax and national insurance payments, Hakuseyan's North London publishing business was coming to terms with losing 90% of its income in just the past week. Glossy brochures are gone and virus information flyers don't fill the void.
We print for a lot of the hotels up West End, we print for schools and we print for corporate clients. As soon as the Prime Minister's announcement came out last week in regards to avoiding bars, the phone stopped.
Nearby on the Seven Sisters Road, walk into any non-food retailer and you'll get the same UK story.
12 o'clock is no coming customer, it's 11:30. I didn't see the customer, and should be, if it's like that, we close it.
Mohammed's family business has been here almost a decade. Nobody saw anything like this coming.
80% customer gone.
80%?
Yes. Sales are going down. I don't know what happened.
So how, as a retailer, do you cope with that? 80% of your customers gone?
Yes, it's very difficult. We can't say anything. Let's see. Many business gonna be closed.
Appearances can, of course, be deceptive, but I suspect what is happening here today on the Seven Sisters Road in North London is happening on high streets right across the UK. On the face of it, things are busy. There are a lot of people about, but they're pretty much all doing one thing: going to the food shops. They line up outside supermarkets, limiting numbers inside because of the panic buying. Ominously, market traders told us wholesale shortages are happening and price hikes on fruit and veg as a result.
We're asking something that you'd normally sell for £2 to £3.50. They haven't got the money, but they're finding the money because of all the pressures going on, the panic.
And all around, mixed messages on public health for the public. Shelter's charity shop is open. Next door, the British Heart Foundation charity shop closed on public health grounds.
Alex Thompson reporting. Well, we asked the government for an interview, but unfortunately, no ministers were available. But joining me now from Westminster is the Conservative MP and former Business Secretary, Greg Clark. Greg Clark, thanks for coming on the programme. The Prime Minister tried to sound upbeat and optimistic today, and he said that businesses have to stand by their employees. But how can businesses do that if banks don't stand by the businesses?
Well, it's a very serious situation for businesses, as your report showed. If they're losing 80% of their sales, and in some cases more, they have a real decision to make, which they're making now, as to whether to get rid of their employees. These are people who will need, when we recover from this crisis, it's no fault of theirs that the crisis has happened. And my view is that the government, not the banks, not just the banks, but the government needs to act to make sure that we hang on to the businesses and the employees within them.
And how did they do that?
Well, it's necessary for, in the absence of revenues, for people to have money to pay their employees, and the government should provide that, and it needs to provide it now. Now is the getting towards the end of the month when the payroll happens. Now is when people are being lost. They will have to go on Social Security, and that will be terrible for them and be a big burden in administrative terms to be processed. By far, the simplest way to proceed, in my view, is to use the tax system that every employer has. They have pay as you earn. They take money in taxes from their employees and send it to the government. In these weeks, they should reverse the flow, and they should have support from the government going in the reverse direction to employees' pay packets on the condition that those people continue to be employed.
Many businesses, small and medium-sized, indeed large ones as well, rely on loans from banks to keep going, to keep paying their employees. The government has said it wants the banks to keep the taps open, but it's not impelling them to do so. So what should the government do to force the banks to do what they're supposed to be doing at the moment?
Well, the banks should be under a requirement to continue to lend and to extend overdraft and lending facilities. That is something that they need collectively to agree. But that, in my view, is not sufficient. The lending scheme that was proposed earlier in the week, I know from talking to businesses in my constituency and beyond, is not going to keep people employed, because business owners and managers of businesses will ask themselves the question, if I take out a loan, then that is going to have to be repaid. How can I know that that's going to be, I'm going to be able to repay it, since this crisis is open-ended? How can I do that? And in fact, if I keep on my stuff, the loan that I'll have to take out is bigger than if I let them go.
Sure.
And so the incentives are completely in the wrong direction, which is why it is a matter of urgency for the government to step in. This is a once-in-a-100-year crisis. It requires a once-in-a-100-year response.
Indeed. I mean, can you, as a former business secretary, envisage what the business landscape will look like once this is all over?
Yes,
when this is all over?
Yes, this is a crisis that has come about suddenly. It's going to take some time to resolve. But unlike other types of economic crises and financial crises, the fundamentals of these businesses that are now under pressure and are going to have to close and are going to have to let people go, there's no question that they won't be needed, let alone viable. So what we need to have is a bridge to resume a prosperous future, and that has to be provided collectively.
Mm-hmm.
This isn't sometimes in previous financial crises, governments have acted as a lender of last resort. The nature of this crisis, it's more like something that an insurer would provide cover against. Now, it's not possible to do it for the event by the insurance companies, but the state should be an insurer of last resort and allow the equivalent of business continuity insurance to kick in so that these viable businesses are not needlessly lost and lost forever, lost permanently.
One more, Greg Clark. I mean, the priority at the moment is safety, trying to flatten that curve, making sure that, you know, as few people as possible get the infection, etc., etc. Do you think it's right for the government still not to call for a comprehensive shutdown, or call it lockdown, of the capital city especially? We've seen it elsewhere in Europe.
The most important thing is that the decisions that the government takes are informed by the evidence of experts. And I have seen, and we've all seen, that you have, in every press conference the Prime Minister gives, he is flanked by the Chief Medical Officer and the Government Chief Scientific Advisor, both of whom draw on the best possible advice. And so as long as that advice is being followed, that's the best that we can do. And everything that I've seen tells me that that advice is being followed. These men that appear with him are substantial figures of authority. And if their advice were not being followed by the Prime Minister, I'm certain that they would draw it to the country's attention.
OK, Greg Clark, thank you very much indeed for joining us. John.
Thank you.
For some children, it's a cause for celebration. But for those ready to sit GCSEs and A-level exams, the plan to close all schools from tomorrow spells uncertainty and turmoil. NHS workers and other key employees will be allowed to send their children to school, but it's not yet known how long schools will remain closed, as Aisha Tull has this report.
Preparing lessons and getting ready for a day ahead. All that's missing, the kids. Even though schools officially close from tomorrow, there are fewer kids here today. And these Year 11s are still reeling from the news.
I feel like this is a movie right now. Like, I never thought this would ever happen in this lifetime. And obviously, this is supposed to be like our main goal to pass our GCSEs, and now it's all gone down to waste. 5 years basically for nothing.
At the moment, honestly, no. I'm kind of stuck, mind bamboozled. I don't know what to do. Like, my whole goal was to focus on GCSEs, pass them, go into sixth form or college, focus on A-levels.
Well, some people are quite relieved because they feel like school gives them stress. But then on the downside, being at home is quite stressful because you have to do more independent learning than before.
A big concern from kids here and across the country is what will happen now that exams are cancelled. How will they know their true grade?
I did try my best for the time, but my motto is for me to learn my mistakes and not repeat them, to do better in my final exam.
7 children came to Breakfast Club here this morning when there were usually 30. They also have empty classrooms.
In the normal course of the day, this would be buzzing with children working hard in their classrooms, and so it's very, very strange to think that this could be the last, today and tomorrow, could be the last days for the remainder of this school year.
Just a couple of miles away in Enfield, this school for special educational needs say they can't even think of closing their doors.
We are a school that pupils have social, emotional, mental health. They have an educational health care plan, so that means they're the most vulnerable. So yes, we're clear that we have to stay open, but also I've got to be sure that my staff are safe. They're worried. They're coming to me, Miss, I'm really worried this morning. I don't know what to do. What are we doing? They're looking to me for answers.
One big knock-on effect for schools being shut is how do children who get free school meals get fed?
Can you just talk me through exactly what is here? Okay, so we're going to be giving out some packets of long life milk. I sent my staff out at about 9:45 this morning, and it took about 2.5 hours for them to just get together, some supplies. And they said to me, Miss, we went to 11 shops and we had to queue in every single shop.
The government are giving vouchers to use at supermarkets, which they say is more than what they pay for free school meals. And for the youngest in our society, there's even more uncertainty. Nurseries say they'll struggle to stay open as most parents are staying away. But for kids thinking this is the start of a very long holiday, teachers want them to know it's not. And there's a lot of homework on the way.
Well, joining me now is Isabel Wrighton, an A-level student who's had her final year exams cancelled after the announcement from the government. Thanks for coming on the programme, Isabel. I see you're not doing your homework at the moment because I guess you've got some leisure time. Were you gutted or were you relieved when you heard the news?
I was absolutely gutted. I've spent 3 years doing my A-levels because I repeated a year, and I've put so much time and so much planning into it.
So what are you going to do now?
I don't know. It's really hard to have something that you've been focusing on for so long taken away from you and to just not have any answers, to be completely left in the dark. I hope I'm going to keep working because whatever happens, I'm sure having good pieces of work will help me. But I have no idea what's going to happen, and I do feel very lost in it all.
I can imagine, absolutely, and because this is what you've been working for so many years. Has the school given you any indication of how they might assess your performance so far? What kind of grade you might get and how?
No, because of Boris's statement being so vague and wishy-washy, we don't know. We've been given the different ways it could happen. So we could get teacher assessment, our predicted grades, or maybe sit the exams in August or September even, but we have no idea what will actually happen.
What do you think would be the fair way of assessing your grade?
I think it's really hard because students have their different moments. Some students work hard all throughout the year. Other students step up at the last moment. I think the exams going ahead would be the most ideal thing, whether that be August or September or when it is.
You prefer to do that, to basically spend the next few months, including the summer, working and then taking exams at the beginning of the next academic year?
Yeah, I would, because a predicted grade, it's a grade, but you haven't earned it in the same way. It doesn't give you that validation. It doesn't give you, as students, we are absolutely taught to drive and work for these grades, and then to have them taken away and just given a predicted grade doesn't have the same sort of satisfaction.
And finally and briefly, how does this affect, I don't know what your plans are, but, university entries, for instance, or any offers you might have received?
I'm really lucky because I've got an unconditional for acting at Bath Spa, but a lot of my friends are really dependent on the grades they get, and their future's completely in the balance because of what's going on.
Of course.
So it's quite a stressful time.
Isabel, I wish you all the best in the future. Good luck and thank you so much for talking to us.
Thank you.
Bye-bye. Well, with hospitals expecting a massive influx of patients, the government has announced that it will allocate £2.9 billion of its emergency COVID-19 fund to free up thousands of hospital beds in England. But staff on the front line of the crisis say that there is still a shortage of protective equipment, a problem authorities across the UK are scrambling to address. Our health and social care correspondent Victoria MacDonald has this report.
The NHS is clear it needs more beds as the number of people with coronavirus grows. Extra wards have been opened in trusts across the country, but some of those are now full. So today the government announced £2.9 billion for helping the elderly and the vulnerable in the community, getting them out of hospital and freeing 15,000 beds in England alone.
The NHS capacity is not a trivial point, in the sense that when you really go over capacity, and it's possible, in any winter we go over capacity a bit in some of these ITU beds, but when you go over capacity, if it goes over in a major way, then the whole system grinds to a halt.
For every bed, though, they need more staff, and today the Health Secretary published emergency legislation allowing recently retired doctors and nurses to come back into the health service. But the question of safety remains, with staff across the country complaining of inadequate supplies. This is what one trauma nurse has told us. They wanted to remain anonymous.
Up until a month ago on my trauma ward, we would use FFP3 masks for any patient in respiratory isolation, but that may have been because that's the supply we had in stock. But we're now being told that we only need FFP3 masks for patients being ventilated. We're wearing surgical masks when carrying out personal care on coronavirus patients. We're feeding them, washing them, brushing their teeth, whilst wearing only a surgical mask. If that's safe, I haven't seen any evidence to say it is.
And in Scotland today, the First Minister was asked why 2/3 of frontline ambulance crews do not yet have the personal protective equipment, or PPE, that they need.
First Minister. That work is underway at pace as we speak. The Health Secretary is meeting this afternoon with the Scottish Ambulance Service and the GMB, the trade union associated with the Scottish Ambulance Service, to make sure that the concerns that frontline workers have are being properly and quickly addressed.
Frontline health staff in Wales are now to be tested for COVID-19, but in England this is still not happening because of a lack of capacity. It is hoped, although there was no detail, that this will change.
The key thing we need to do is get the testing out. The first priority was ITUs, second priority all the people who've got symptoms, but the next priority for us is to get the NHS workers so we can test them quickly, and then if they've got it, fine, they continue, but they know they've had it once. If they have not got it, then they can come back to work.
That is testing to tell them they have the virus right now. The next development needed is an antibody test to see how many people have had COVID-19, which is critical for mapping this disease, but also so NHS staff don't need to self-isolate and can return to the front line.
Victoria joins me now. Victoria, in the Prime Minister's press conference, we heard a slightly more optimistic note, a kind of a sense of, maybe some light at the end of the tunnel. Do the facts justify the optimism?
Well, it feels a bit like Psychology 101, doesn't it? That the nation has been sort of desperately depressed, is becoming desperately depressed by this whole thing, so let's give them a bit of good news. So we have some antibody testing that we think is going ahead, which will tell us if we've had the virus. The first British patient has gone into a randomised trial for treatment, and they said that there is more testing on the way. So all that is good news. But the fact is, we're not even anywhere near the peak. We have the worst to come, I'm afraid to say. And that was very clear today when the chief scientific advisor actually told people off in a way. He said, we are only going to get on top of this if everybody follows the advice. And he particularly said this to young people: stop going to pubs, stop going to restaurants, because we need all of you to do what we're asking.